So I work for a number of different companies that are involved in making sure that health and safety and well-being is enforced and put in place in particular environments. And so one of the most powerful pieces of legislation that you have to know about is an act called the Health and Safety at Work Act 1974, because it was produced then. It's a piece of legislation that applies to every organization in the UK. And so it's important that everyone working in an environment, professional environment, anyone, whether they are employed, self-employed, everyone works in a way that is safe and that the people there have a legal obligation and responsibility to work in a safe manner. That's essentially what is outlined in the Act itself. So if you're studying BTEC science or T-level, that is something that you really have to become aware of and come to terms with. So learn a good definition for the Health and Safety at Work Act and understand from this video what it is actually for. So in a scientific environment, you might have heard of SOPs, standard operational procedures. They have to be put in place for any and all people who work in a scientific or health environment. Risk assessments have to be written out, especially for hazardous chemicals and processes that could potentially cause harm. And most importantly, that information needs to be accessible to the workers and the people who actually use the facilities on a day-to-day basis, or anytime actually. Because if the information and the SOPs are not available, then an accident can happen. And actually, there are serious legal implications that could happen too. Control of substances hazardous to health regulations is another set that you need to be familiar with, or COSH. COSH, if you're not sure what that is, maybe do a little bit of reading around. So in a medical and scientific environment, we are often required to deal with substances that could potentially cause us problems, health problems. So there are ways in which you handle those substances to minimize risk. And COSH teaches you this. So many substances can be hazardous to health, including body fluids or acids, depending on whether you are working in a medical environment or a scientific environment. It all depends. So there are many substances that could potentially be chemical hazards or biohazards. So just like a virus, there are ways in which a hazardous substance can enter the body, or routes of entry. And they include consuming the substance. It could be accidental consumption, injecting it, or inhaling the substance itself. And whichever route of entry potentially could cause harm it's important that you utilize protective equipment to stop that from happening. For example, if you're working with a substance that could be inhaled and damage your lungs, working in a fume cupboard, wearing a mask, and depending on how dangerous this substance is, you need to put in place safety protocols to stop that from happening. If there's a chance of infecting your body or damaging your body through swallowing the material, then getting it on your hands and not washing them later could potentially put you at risk. So it's very important to maybe put gloves on or double glove if you're dealing with something highly infectious. And so think about what it is you're dealing with and how to minimize the risk of infecting yourself and others. So if you like videos like this, make sure you hit the like button and subscribe and share this with anyone who is taking T-level or BTEC science. I haven't made many videos on this page because I've been pushing a few other things. But if this is something that you like and that you would find valuable, I'd like to see the thumbs up. I'd like to see people subscribing and commenting and asking for things, and then I will make more videos. But in the meantime, I wish you all the best with your studies.